Thousands of Rohingya refugees in the city may be left to starve as the NGOs there, which had been helping them during the Movement Control Order or MCO that our correspondent was talking about, run out of food. That and more from our EBC correspondent in Malaysia, Ruby Tinawin. Ruby?
Yes, hi Alma. Good afternoon to all the viewers. For today, yes, you're right. Thousands of Rohingya refugees, those are the people from Myanmar, in the city may be left to serve as the NGOs which had been helping them during the movement control order ran out of food. A report highlighted the struggle of these refugees as they don't have enough food or any supplies, and they are struggling to survive. They have yet to receive any aid from the government, and NGOs have run out of supplies to give them too. Many of these Rohingya were hesitant to get themselves screened for COVID-19 at government facilities despite Putrajaya's assurance that their immigration status would not get them to trouble. Reports said they are worried because if they are suspected of being infected, they will be taken for isolation, and they don't have money. They might lose everything. An NGO representative said many refugees told him they were still charged with registration fees for screening, which could range between 20 ringgit and 40 ringgit for UNHCR card holders, and double that amount for those without documents. Also, Singapore Ministry of Health on Sunday reported 233 new cases of COVID-19, 10 of them Malaysians. So these Malaysians, those infected with COVID-19, here is the breakdown. 5 of them were linked to case 2215, a patient who is a Singapore permanent resident. 1 linked to case 2424, a Bangladesh national. 3 of them are linked to, say, unspecified local unlinked cases. I mean, they're still tracing where did they get the infection. While the latest one is a Malaysian man, age 25. He was linked to a McDonald's restaurant that is a new cluster for Singapore. Now, Singapore, as of Sunday noon, has identified 28,140 contacts who have been quarantined. In fact, earlier on, Singapore won international renown for establishing best practice pandemic control. But now the number of COVID-19 cases has begun to rise. The first wave of cases appears to have been mostly among travelers, but the virus is beginning to break through social distancing, contact tracing, and medical defenses. Now, the government's nod for businesses like full-service laundry shop and hairdressers to operate during the movement control order is only for green zones under the Health Ministry's designation. It is not for the whole of Malaysia. This is what was clarified by Datuk Seri Wan Junaidi Tuanku Jaafar, who is Malaysia's Entrepreneur Development and Cooperative Minister. He said the list of additional services that would have operating restriction lifted was drawn up by a special cabinet committee that was formed on the instruction of the Prime Minister during a cabinet meeting 2 weeks ago. In the Health Ministry's daily maps of the nationwide distribution of COVID-19 case recorded by district, there are 29 districts that are green zones, or districts where no COVID-19 cases being reported as of April 11. So he further explained that the Special Cabinet Committee was concerned about the effects of prolonged MCO on the country's economy, noting that there were business communities from all sectors that were adamant about their business sustainability, and that there were also international firms that has invested billions in the country. With the extension of MCO until April 28, the Ministry of International Trade and Industry also announced additional sectors that will be allowed to operate during the MCO period, on top of the essential services previously already allowed to operate. The additional sectors include automotive industry, machinery and equipment, aerospace, construction, hardware, electrical and electronic stores, optometrists in the wholesale and retail industry, science, professional and technical services, including R&D, social health care, hairdressers, full-service laundry shops. So Juan Junaidi said the government will introduce standard operating procedures and protocols for these businesses with strict supervision by the police and army, with no breaches of such SOPs or protocols to be allowed. And also, for now, seeking answers. Malaysians are seeking answers, and I believe this is worldwide, why more men die of COVID-19. There is a question. Is COVID-19 a sexist disease? It appears that it may well be, as more than men than women are being reported as victims of the virus. Data released by the Health Ministry in Malaysia shows that 58 out of 76 Malaysians who have died of COVID-19 are men. That means 76% of the total. And the result seems to form a similar proportion observed around the world. The Malaysian percentage is higher than those reported in Italy, which is 68%, China 64%, Germany and Spain 63%, Australia and Sweden 60%, and this was according to Global Health Research Group. Malaysian Medical Association President Dr. Gana Baskaran told in one of his interviews that it's still not unclear why so many men died as compared to women. However, one theory is that men are more likely to partake in unhealthy habits, which are associated with developing chronic diseases. Among these lifestyle choices are alcohol and tobacco consumption. So smokers are therefore considered at risk of developing complications such as respiratory difficulties and pneumonia if they catch coronavirus, because their respiratory health is likely to be poor. It may even be that smokers are also more likely to catch a virus in the first place itself because of the action of putting their hands into their mouth, using unwashed hands to roll cigarettes, or even sharing cigarettes. Last month, a study published in Lancet British Medical Journal said emerging evidence suggested that the reason for more male death lay in is based on sex-based immunological or gender differences. Again, they highlighted lifestyle habits and prevalence of smoking. Now, Malaysia, way back 2015, when they conducted Malaysian Formibity for BDT survey, showed that Malaysian men were particularly vulnerable to diseases due to combination of unhealthy diets, physical inactivity, tobacco use, and harmful alcohol consumption. So, according to World Health Organization, around 110,000 people have died of COVID-19, which has spread to 213 countries and infected more than 1.8 people worldwide. Alma?
For men. That's why it seems that it might be men's vulnerability that makes a difference because of their lifestyle. Is that
Yes,
what they're
that's right,
saying?
Alma.
Okay. So it is the same case as being presented all over the world in some parts of the countries. Okay. Thank you so much for that update. And you be sure to stay strong and stay healthy. Thank you so much, Ruby.
Yes. Reporting live from Malaysia, this is Ruby Tinawin. We live in interesting times.